Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Merai DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Joseph Merai. You're fairly new to the area, but you're here as a dentist. Your specialty is general dentistry, and you work with Gray, Allen, and Associates.
Well, yeah, thank you. Welcome. Thank you for welcoming me to the show. Been here about a year and a half, practicing probably about 2 years now.
Now, you are a DMD, and you said that's very similar to a DDS, is what many of us are used to seeing as the letters behind the name.
Some schools specifically pick certain letters. It just boils down to being the same thing. Your dentist is a dentist.
So you are a dentist, and you are here because we would like to talk about some important topics related to oral health. And actually, what stimulated this show getting going was some recent controversy about the role of flossing. So we'll get to that. That's kind of a hot topic. A lot of us have been wondering, been told to floss all these years, and then some report came out that said maybe not so much. So we'll get to that, but before we do, please tell us why taking good care of our mouths is so important.
Well, you know, everything in the body is connected. Your mouth, your heart, everything in your whole body is in balance. Now, if something goes wrong in your mouth, chances are you'll probably feel it somewhere else. Now, the number one complaint patients come in with when there's something wrong with their mouth, what's very common is that they'll point to their jaw or their sinuses. Sometimes patients will mistake tooth issues for sinus issues. Everything is connected. So in order to make everything healthy, and just like you want to take care of your heart, your lungs, everything like that, your weight, you got to also take care of your mouth. You got to take care of your gums, your teeth, your breath, your tongue, everything. It's all connected, and honestly, you don't want to wait until something starts hurting. Honestly, there's probably the best way to do it is you got to take care of yourself at home. You have to brush every day, at least twice a day, hopefully. Floss at least once a day. We'll get to that. And the last thing, you have to visit your dentist every 6 months. It might change depending on your specific health, but in general, we recommend 6 months.
And when should people start going to the dentist? This is more for our parents in the group.
Yeah. We recommend that once you see the first tooth in the mouth, you should probably come and see the dentist. Now, there's no harm starting earlier. Now, we do get infants that are 3 months old, but the reason we do that is so that we can desensitize them to having to open their mouth and having someone with a mirror in their mouth. Honestly, it just helps. And a lot to do with pediatric dentistry is making sure you don't traumatize them. So the earlier you get in there and the less you hurt them, chances are as they get older, 6, 7, 8, and if they need something done, they won't be as scared.
Well, that's good because, you know, a lot of people are very afraid of the dentist, even though it's an important part of overall health. Let's get back to brushing. You said twice a day at minimum people should brush, and some people may have to brush more if they have problems with bad breath.
So when a patient comes in and I sit down and talk to them about brushing and flossing and everything like that, I have to be very specific because honestly, most people, they've never had a class on brushing. The dentist as a child probably didn't cover it too much as well. So I sit down, I talk about circular motions and the angles you're supposed to be brushing and the areas you're brushing, as well as your tongue. Now, it's up to you whether or not you want to brush your tongue. It's not required to have optimal oral health. It's more about your teeth and your gums and so forth and so on. But basically, the goal is to get plaque off anywhere in your mouth. And if you debulk most of that, chances are you also help the breath. But at the same time, we just want to get rid of as many bad bacteria as we can every day throughout the day. So traditionally we say once in the morning, once at night. But depending on, you know, if you've been experiencing having more cavities than usual, I might tell you, yeah, maybe you should do it after lunch. Maybe I also address your diet. That's another thing. Now, that's usually a sore subject with most people, but I try to be as sensitive as possible, but sticking to the major points. What foods are more likely to cause you to have cavities? What's more likely to break down your teeth? What's more likely to stain your teeth? And these are all things people can relate to.
Well, what would those foods be? I mean, I guess candy and chewy things tend to be more problematic.
Those are the most popular things. Anything with sugar, things that most people don't think about is, for example, I know a lot of people that are conscious about their weight will probably try and stick to diet Pepsi, just cut down on the sugar. But the fact that the acid is still there, it's still breaking down your teeth. The more acidic you make your mouth, the more likely you're going to get a cavity. The bacteria just love it.
So diet soda is
Diet
just
soda is
as,
one.
yeah.
Fruits have a high sugar content as well. It can be broken down, and the bacteria in your mouth do like that as well. Other things is like orange juice. Some people prefer to eat breakfast before they brush their teeth. Now, if you have orange juice in your mouth, it's acidic, and then you decide to take a toothbrush to it, you're rubbing the acid into your tooth. So generally, we recommend, if you're going to have anything acidic, wait maybe 30 minutes before you brush, or maybe rinse out with water afterwards.
Yeah, I was going to say, can you just rinse then? Well, I think of things like caramel, you know, and it's just horrible for your teeth as far as just sticking there with that sugar. And you're saying, talk about staining, the obvious things, coffee, wine, tea.
Coffee, wine, tea are the big three. Now, I never tell my patients don't drink coffee, because I drink tons of coffee. So what I usually tell them to do is, if you're going to drink the coffee, drink it. Don't sip on it. A lot of the growth of bacteria depends on how much you're giving them. So if you extend this over, say, the whole morning, 6 hours, you're constantly feeling that bacteria every couple seconds with another sip, another sip, another sip. Drink it all, so it's just one dose of coffee, and then maybe rinse your teeth off, go into the bathroom,
And that's more for
take
the
a sip of
staining
water.
then?
It's a combination of both. It helps,
The acid and the staining.
helps with the cavities, and also at the same time, you're not having that coffee stain your teeth.
I guess the less sugar you add to it, the better.
It's a whole picture kind of thing.
Oh.
Tea, depending on the tea, is much more likely to stain your teeth. Soda also darkens the color of your teeth. Everybody wants the bright white, and everybody wants to whiten their teeth. But, you know, it's a delicate balance. You want to whiten, and at the same time, you have to maintain it by having a good diet.
Let's talk about brushing a little more. You're saying there's a definite technique that works best, and then I know I swear by it is the electric toothbrush can be a very helpful device for people that tend to brush incorrectly or brush too hard. So talk a little bit about the electric toothbrush.
So personally, I love an electric toothbrush. I recommend it to all my patients. Now, is it a necessity? No. But does it help? Without a doubt. Kind of takes some of the pressure off. A lot of things I'll talk about when I'm talking to a patient about brushing, is not applying enough pressure. No, don't apply too much pressure.
Too much pressure.
Softer the better. At the same time, I talk to them about how long they're doing it. That's a big benefit of having an electric toothbrush. We recommend 2 minutes of solid brushing time on all surfaces of your teeth. The good thing about most electric toothbrushes is that they have a built-in timer. At the end of the 2 minutes, usually it automatically cuts off. And in addition, if you're brushing too hard, usually it'll start beeping and it'll stop brushing, and you lighten up the pressure a bit. And they have different settings if you really want to get into it. But the idea is, if something's going to help you, get it. And I really like the idea of the timer, and it's stopping when you're brushing too hard. As far as using a manual toothbrush, I still use a manual toothbrush. There's nothing wrong with a manual toothbrush, and it's also much cheaper.
Right, I know the electric ones run the gamut of price ranges. I know you can buy them for like $30, or you can spend more for the Cadillac model. But of course, the ongoing expense is replacing the heads every so often. So,
one of the nicer things about, say, for example, electric toothbrushes, especially if you have a young child and they're not spending 2 minutes brushing their teeth, you can go into Walmart and there are cheaper toothbrushes you can buy that are electric, and they still have the timer, and at least you know that they're at least doing the 2 minutes. Not everyone can stand and watch their kid brush their teeth for 2 minutes, or even do it for them, which happens a lot of times.
Okay, so why don't we move on to the topic of flossing? Tell us what's going on with flossing, and what are your recommendations on this, given some of the evidence that's come out of late?
So earlier this past summer, there was an article that was put out discussing, is flossing really necessary? And it all stems from the recommendations of the Department of Health. Every year, well, not every year, every couple of years, they put forth a certain amount of recommendations, dietary, everything health-wise. This year, they decided to leave out flossing from it. The reason being is that the evidence behind flossing is not that strong. Are there studies that examine flossing and how effective it is? Yes. Do I feel like the highest level of studies? No. But does that mean flossing is truly not necessary? No. At the end of the day, just because there's not a study behind it does it really hurt you to floss? Does it hurt you to floss every day? And I always still recommend to all my patients to floss at least every day. What I tell them to do, especially if someone's a little unsure whether or not it's worth it, I tell them, don't floss for a week. Then take the floss back and take it to one of your back teeth, put the floss in, take it back out, look at it, and then smell it. And you're going to notice a significant difference as if you were flossing every day. So there's definitely something to it in terms of getting things out of the contacts between your teeth. Now, that's probably one of the biggest areas in terms of where you get cavities, especially as you get older. But flossing, definitely, that's a go.
It makes perfect sense to me to be able to get some of that food out that kind of goes down in between the sides and such. And I know when I don't floss, I notice because my gums will start bleeding a little more than usual. So to me, it makes perfect sense to floss. So it caused quite the fervor, I think, because all of us who know that flossing's a good thing, we're kind of surprised. So you're saying even though the evidence isn't as strong, it's still a good idea because you were physically removing some of the remnants of food from your teeth.
Exactly. The reason we floss is twofold. One, you want to get anything that's in between the two teeth that could cause a cavity out. The second reason we do it is for the health of the gums. You want to take out as much bacteria as you can so the gums don't bleed as much. And hopefully, if you do it on a consistent basis every day for maybe about 2 weeks, by the end of the 2 weeks, when you floss, hopefully it won't bleed. And that's probably the best sign that you're doing it well.
Does it help with bad breath as well, I imagine, or no?
Well, I think if you have a lot of stuff stuck in between, it helps. But usually, it's the issue of having anything on your tongue.
Okay.
But usually, if a patient comes in complaining of bad breath, I tell them, have you tried brushing your tongue? Mouth rinses, anything like that. Another thing could be dry mouth, which we'll touch on later, which is a big cause of bad breath.
Isn't bad breath also a function of what you eat, certain compounds that you ingest that actually just come out in your breath, per se?
Your diet has a huge impact on how all of your smells are.
Never thought of it that way, but
sweat in general,
exactly.
Your mouth, everything like that. It has a huge impact on your health, your breath, everything that goes along with it. But yes, it does have a huge impact on your breath.
And then just to summarize about dental checkups, you're saying it every 6 months is recommended to look not only for cavities, but you also do a lot of inspection of the mouth, the gums, the tongue, places where people don't typically look for possible lesions, say?
So a lot of patients will come in and we'll always see them every 6 months and say, Doc, I haven't had a cavity in a while. Why am I coming so often? Maybe I can come back to once a year. And what I usually tell them is it's more than just checking for cavity. It's more than just me poking your gums. I also have to check for oral cancer. Oral cancer is something, when it does happen, progresses very quickly, or we're catching it too late. Now, as of right now, at least 1% of the population at some point in their life will experience oral cancer. And honestly, it's one of the cancers where you probably won't see or feel anything. You also don't usually inspect your mouth in front of a mirror. Usually that's up to the dentist or the physician to look in your mouth. And the most common places for oral cancer to occur are on the tongue and underneath your tongue. Those aren't spots that most patients will look. And usually when you go to the dentist, at least I know I do, I'll grab your tongue with a piece of gauze and I'll take it out and then really look. And it's not pleasant for you, but it's something you got to do. And usually, if we catch it early, it's pretty good in terms of prognosis, in terms of you surviving it and living a normal life. But it's still very common. And as of right now, even over the course of the past 10 years, the survival rate for oral cancer has stayed about the same. It's still about 50%. It hasn't improved. So it's important to go see your dentist, let them do the oral cancer screening, make sure nothing is bad. You don't want it to wait too long.
What are some risk factors for it? I mean, I think smoking, correct? And plus that stains the teeth and it's a risk factor.
Smoking is not good for anything.
Right, I know. I keep telling my students that. It's linked to over 75 different problematic conditions, including cancer.
Now, risk factors. Risk factors for oral cancer. Number one, there's two of them. Two ones I want to discuss at least. The big one is smoking. Now, that smoking doesn't necessarily have to be using actual cigarette. What's popular right now is flavored cigarettes, e-cigarettes, vape, well, vape, the younger guys, stuff like that. But we don't know what's in there. We really don't know.
And chewing tobacco.
Chewing
and
tobacco
it's right
is very
inside there on your gum and inside mouth surface.
It's very, honestly,
Very dangerous.
I'm not originally from the area. When I came down here, then I became familiar with dipping and putting tobacco in the corner of your fold of your mouth. And honestly, when I check and do oral cancer screening, I can usually tell before you tell me if you use it. Because I can definitely see the effects on your gum. I can see where it changes white and red. And those are the first signs of something going wrong. And that's usually when I'll send you out to probably get a biopsy to just rule it out that it's nothing cancerous. But more than that, be careful what you put in your mouth. Any vapor, any smoke, anything like that.
E-cigarettes have been linked?
It hasn't. The evidence behind it is not 100% yet, but at the same time, is it worth taking the risk?
Right.
There's still a high nicotine content. Actually, more than any cigarette you'll ever use. I think as it's marketed, it's saying it's one e-cigarette cartridge is about 1 pack of 20 cigarettes. That's a very high nicotine content, and we don't know what its impact is on your oral health. The second risk factor that's pretty important is alcohol. Alcohol, again, not great for your oral health either. But that's another huge factor. Any toxin that you introduce to your oral cavity is probably going to put you at risk for something more serious.
And that's two legal things right there that people do quite a bit. And I know, getting back to the smokeless tobacco, it's a very tough habit to break. People need a lot of support to break that habit. And alcohol, I guess, the same, you could say. But many people drink socially, but don't realize the damage.
I'm not going to condemn anybody for drinking, but at the same time, everything in moderation.
Moderation.
Everything in moderation.
So the next thing we want to get to, I know you had some other issues you wanted to discuss. One is antibiotics.
In the practice, when patients come in, there seems to be a lot of confusion, and rightfully so. There's been many changes of whether or not a certain person should take an antibiotic before they come to their dentist, whether it be for just a cleaning, or if they're getting a tooth extracted, taken out, or if they're getting just a filling. It could be a whole list of procedures you're coming for. And over the years, there's been a lot of different recommendations. And it seems to be changing, and there seems to be a lot of disagreement. Now, as of 2015, the recommendations are very specific. Usually, there's never a solid no, but in terms of having a prosthetic joint, if you have, like, say, for example, a knee replacement, hip replacement, we're not currently recommending you take an antibiotic before you come to the dentist. Now, if there's someone who comes in and says, you know, doc, I've had maybe a couple joints replaced over the years, is it really worth the risk? And then at that point, the best thing to do is I usually call an orthopedist or the PCP, the regular physician, and ask them what do they think, because they're the person who's probably been dealing with this patient, and they have to deal with the consequences.
So is this a loosening of guidelines then, not requiring antibiotics in so many cases than we used to?
I wouldn't say loosening. I think there's been a huge push to prove that dental bacteria would impact, say, a joint or your heart. If you have maybe a murmur or something like that, there's been a push to see if there's actual proof, and there hasn't been any yet. And at the same time, we as dentists have usually been identified as overprescribing. We usually want to play it as safe as possible, but at the same time, overprescribing will have its own consequences down the line. Well,
we have all the, controversy about overprescribing of antibiotics and the result of these superbugs resistant bacteria. So I guess it's a good thing that we're starting to think more about the evidence. Now, what about fluoridation? I know you wanted to talk about that for a few minutes.
That is usually a really big topic, especially with parents that have young children. There's a lot of questions that come up. They've seen a lot of things about, is fluoride, am I poisoning my child by giving them fluoride? Now, fluoride has probably been in public water since the 1940s. And there's been many, many, many studies as to whether or not fluoride will decrease the incidence of cavities in young children. And usually those studies have showed that 50% less cavities in children that have fluoride in the water than those that don't. Now, the issue comes in, is there such a thing as too much fluoride? And without a doubt, yes. Like anything in life, there is always a limit. We
just talked about moderation.
Yeah, exactly. There's always a limit to how much someone can take. And there are limits. It's usually for an adult, it's 5 to 10 grams, which is really a lot. It's like if you, that's why we tell you, don't leave your young children around a tube of toothpaste. We don't want them to go and eat the whole thing. You don't, it might have a nice color, it might have these little flecks of mint in them or something like that. But I think overall, it's more important that you don't want your kids to have these infections in their mouth.
Well, don't kids get like special treatments or fluoride applied to their teeth? I know both my sons did, and I don't think either one's ever had a cavity. Just things have changed so dramatically in dentistry now, it seems, with just better care and kids getting these treatments.
So yeah, when a kid comes in, we'll add this, we call it a varnish or teeth vitamins for the young kids that we'll tell them, and you paint them on, and hopefully it just strengthens their teeth for, you know, the next couple days, weeks. But more importantly, if you look at our patient population now, the people that come into our office, I have tons of adult patients now that are coming in with full set of teeth. If I talk with the other doctors in my office, it hasn't always been that way. Traditionally, you know, maybe you hit 65, 70, 75, 80, and most patients start transitioning to wearing a denture, which is very common. But nowadays, I have patients that have full set of teeth. I have patients that are 95 years old and not a single filling. But I do, in some part, attribute that to fluoride in the water, use of sealants, which is a big thing we're doing for kids nowadays.
Right, the sealants.
And I think all together, I think that's what's cutting down the number of cavities people are having.
I know dentures may be a thing of the past someday, huh? With a lot of people, you know, getting the younger generation with this improved dental care. Because I know my parents are much older, and their generation, just about everybody had either dentures or a partial.
Hopefully, because honestly, I don't like making dentures that much. But honestly, the big part of that is because patients don't enjoy having it. It's a lot to lose your teeth. There's nothing that's going to ever replace your natural tooth, other than maybe something that's like an implant or something like that. But dentures themselves, we tell patients you probably get 1/5 of the function if you had it.
Yeah, that's what I heard. It's very low chewing efficiency with dentures, plus all the problems you can have with them.
You then have a whole list of issues in terms of eating, things you never thought about. How you speak may change, the way your face looks may look a little more collapsed or a little too stretched. You might feel like there's a little too much in your mouth. It's a very sensitive thing, and a lot of patients take a while to get used to wearing dentures. But it's something that comes along, and I think it's getting cut down. I think less people are wearing it.
Yeah, that's good news. And I know you also want to talk about fillings, because there's also been people concerned about the silver fillings versus the white or composite fillings.
So I think what most people think about is silver fillings bad. But I think what's more important is that you weigh the pros and cons, which you leave up to your dentist. Does he believe that I need a white filling or a silver filling? A lot of people might sway away from the silver filling because they think silver, they think mercury. The presence of mercury in those metal silver fillings has changed a lot. Historically, the dentist itself would probably mix the metal filling, place the liquid mercury and then the silver, and then mix it together, so it wasn't as controlled. Nowadays, all the silver fillings come prepackaged. You'll hear like a big vibrating in the background before they put the filling in your mouth. And everything is pre-measured doses. And in terms of how much mercury is released from a filling, the only times that there's actually a significant exposure is when A, when you put the filling in the mouth, and B, when you take the filling out. So there's a lot of people that will tell you, you know what, you'll come into their office and they'll tell you, you know what, you need all your silver fillings taken out. This mercury is probably killing you. You don't even know what's in this. By taking it out, you're exposing yourself to even more than if you had left the filling in your mouth for the rest of your life.
So just leave it in?
Just leave it. I never take out a filling if it looks good. It looks good in my eyes, I guess. You might not like the way it looks. But if I think the filling is going to do you a good job, I'll leave it alone.
Because it's stronger, isn't it? The silver is the silver stronger than the white composite?
Recently, the research is showing that they're about the same. Now, the reason why I might say you come in and I tell you, you know what, you need a silver filling. The reason I might lean that way is because maybe I can't get your mouth dry enough. Putting a white filling in is very sensitive. Everything has to be bone dry, or else you know it's gonna eventually fall out, or you get another cavity underneath it. Metal fillings, they've been around for so long, it's less technique sensitive.
Oh, okay.
So it's easier for us to place it, and I have to worry less about it deteriorating over the lifetime.
Well, I know one last topic you want to talk about, and this is more for the older adult population, is xerostomia, which is a fancy word for dry mouth. Why is that such a problem, and what can be done about it?
Now, dry mouth. No, I don't want to lump all, just say old people in dry mouth. Anybody can have dry mouth. Now, is it a coincidence? Does it correlate as you get older, you're more likely to have dry mouth? Yes, 100%. And the reason is not because you're getting older or anything like that. Usually the reason is the number of medications you're taking. Now, generally, 40% of the population over 65 is on 4 or more medications, which is a lot. It's a lot. And you might even look at those 4 bottles you have at home, and probably 3 of them might have side effect dry mouth. So dry mouth, what does it mean for you? Besides that your lips stick together, or you have to constantly sip on water. Dentally, it means you're much more at risk for having cavities, having gum issues, having to need a root canal, or have a tooth taken out. When your mouth is drier, the bacteria replicate, well, they grow more, and it's more likely to break down your teeth. Your saliva, your spit, for lack of a better word, is very important in controlling the amount of bacteria in your mouth.
Right. I mean, that's a natural thing, and as you age, you may not put out as much, and then a lot of older adults just don't drink as much either. They're just not as thirsty.
It's probably one of the biggest complaints I get in the practice is that, Doc, what can I do for the dry mouth I have?
So what can you do?
So there are a couple of things you do. The number one suggestion, usually not from me, is to change the medication, which I probably wouldn't do. You have to treat the underlying cause first. Now, as far as dry mouth, I always tell patients, walk around with a bottle of water. You have to constantly keep your mouth hydrated. Now, there's products that you can go down any aisle in CVS, any of these local stores, and you'll see a whole list of products. Popular names might be like Biotine. There are lozenges that people will have. But you have to be very careful on what you pick and choose. Pick one thing, try it out, see if it helps. A mistake that I see a lot of patients do is that they'll suck on maybe a piece of candy. Because sucking on something will cause you to salivate more. But the issue is now you have sugar in your mouth all day.
Well, should it be sugar-free? Would that be a better
100%.
alternative?
They spell specific tablets to help you with producing saliva. But dry mouth is probably one of the #1 reasons in these older patients that haven't had cavities in probably 20 years. All of a sudden, every 6 months they come in and they're having cavity here, cavity there. And eventually, sometimes it might be too late and they might need a tooth taken out. And they're not the regular cavities where it's easy to spot. A lot of the times, these cavities will be along the gum line, on the tongue side where you can't see it.
Unless you get X-rays, right? Do you recommend X-rays every year to get X-rays?
It depends on the patient, but for the most part, we take X-rays every 6 months. Especially if I know that you've had cavities every time you come in. It's really the dentist's call. Like, I don't want another big thing. Just aside, is that people are worried about how many X-rays they get. And honestly, I will base that decision on your current health. Now, if I have a patient that comes in every month, they have never had a cavity, probably I'll be more lenient and not have to ask them to have X-rays taken.
Well, the expense too. I know people, are worried about the expense of seeing a dentist. If they have to drop anything, they see a doctor and don't go to the dentist, not knowing how important it is to take good care of your mouth. So just to wrap up then, we touched on a lot of topics today, but brushing, flossing, and dental checkups are all so very important in taking good care of your mouth. Anything else you want to stress?
Without a doubt. Now, honestly, going to your dentist is probably one of the most important things. You have to get checked up. You can't see inside your mouth. And I really don't want people to especially take away the whole aspect of the oral cancer. Also, I don't want to scare anybody either.
Right.
Now, a lot of times what patients are really nervous about is the cost of dentistry. It's expensive. Any type of healthcare usually nowadays is much more expensive. And especially the way the government is now, there are programs that most people qualify for that will allow you to see a dentist every 6 months. But just be cognizant of what the plans offer. Be cognizant of that, because some plans may not allow you to have cleanings every 6 months. They might not allow you to save a tooth. They might guide you more towards having the tooth taken out. but that's a whole another side.
Right, I know. I think the cost of not seeing a dentist,
Yeah.
then it can really be expensive when you're dealing with complications that can arise. And of course, being in certain risky populations, you know, with chewing tobacco, it's even more important to make sure you get your mouth checked. But good oral care, it's just a great topic, and I thank you very much for being on the program.
Thank you for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.